I'd like to welcome you all today to today's speaker event. My name is Allison Chung, and I'm a medical student here at the university. I'm also the president of the One Health Student Consortium, and we're so thrilled to be hosting today's seminar with the Center for Global Health Equity. The One Health Student Consortium unites graduate students from the School of Medicine, School of Public Health, and the School for Environment and Sustainability. We embrace the One Health idea that human health, animal health, and environmental health are all interconnected. Our mission is to bring together students from across our different silos to collaborate on issues at the intersection of human, animal, and environmental health. Our One Health efforts so far have included advocating for a One Health certificate program here at the university, drafting a policy brief for avian influenza pandemic preparedness, connecting students to One Health research here at the university, and organizing speaker events like today's event. Today's seminar is also part of the Center for Global Health Equity's Distinguished Speaker Series, the third seminar this year. The Center for Global Health Equity works across disciplines, both here at the university and with partners around the world, to find equitable ways to prevent disease and improve health, especially in low and middle income countries. These seminars are opportunities for our scholars and their partners to engage us in interdisciplinary dialogue around some of the most critical issues in global health in a solutions-focused way. We're so honored that CGHE's director, Dr. Joe Kolars, will be providing some closing remarks at the end of today's program. We're also very honored to be hearing today from two esteemed speakers whose work exemplifies the critical dialogue at the intersection of human and environmental health. Firstly, we're pleased to welcome Dr. V. Koski-Karell, who is currently a second-year resident at the University of Washington's Emergency Medicine Residency Program. Dr. Koski-Karell first traveled to Haiti in 2008, and with the outbreak of cholera in 2010, dedicated years to fieldwork, advocacy, and research in Haiti. Their academic journey at the University of Michigan involved dual degrees in medicine and social cultural anthropology, showcasing a deep dedication to understanding health through a multifaceted lens. We also welcome Professor Jackie Goodrich from the School of Public Health, whose research bridges toxicology, epidemiology, and epigenomics to shed light on environmental exposures affecting vulnerable populations around the globe. As a co-leader of the Do Goods Pie Environmental Epigenetics Lab and the Panomics and Data Sciences core of the M-LEAD Center, Jackie's work informs policies aimed at reducing environmental injustices and protecting public health. Thank you for joining us as we engage in these discussions and work together towards sustainable solutions. Without further ado, please join me in welcoming our speakers.
Great. Hi, everyone. Thank you so much for being here. You can call me V. That's totally fine. Doesn't have to be very formal. Thank you, Allison, for that wonderful introduction. Really excited to be back at Michigan. So when I was first invited to give a talk, I expected it to be, in the medical school in a small room with a handful of students. So this was really thrilling to have this escalate in a way to something a bit larger and more involved and interactive. So I hope to maintain that spirit of the seminar and make this interactive and approachable. So I'm glad to share the space with Jackie as well. So just want to start by saying I have no disclosures. I'm a resident, so definitely not very financially involved beyond that. And my talk right now, it's going to be pretty brief. We'll start with a presentation about the background and intersections of global health equity and One Health, but it will also kind of dive into a discussion of cholera and rice. So it's going to be a bit of a wandering journey. So I invite you to join me. This is going to be a graph that you will see that involves year on the y-axis and me talking on the x-axis. And this is what to expect in the next 15 minutes, something approximately that will look like this. I drew this up by hand because I don't know how to use AI or any other major technology. But we'll start pretty in the present day and then quickly go into the past and make our way back to now. So I wanted to start by discussing health equity, which I don't want to assume everyone here is completely familiar with and has a long history that I can't entirely get into, but just briefly, I went on the World Health Organization website, which I think is very relevant to this talk in many ways that I'll show shortly, but they provide a really wonderful synopsis of what health equity entails by starting out with saying that equity is the absence of unfair, avoidable or remediable differences among groups of people. And these groups can be defined in however way. But I think that that's really key and center is like noting that it's the absence of this unfairness. And health equity are shaped by the conditions in which people are living, working, aging, interacting with one another, as well as biological factors that contribute to people's health and health outcomes and trajectories. And in this context, it's important to know that people's living conditions are often made worse by discrimination and stereotyping, as well as prejudice. Things like racism, sexism, all of those forces also shape health and health equity. And the World Health Organization makes a point of saying that realizing the right to health must involve systematically identifying and eliminating these inequities resulting from differences in the distribution of power and resources. And these power and resources are structured by social determinants, I would say, as well as shaped by those factors of discrimination, stereotyping, prejudice that I mentioned. So then we can talk about One Health and how this is a bit different. I think it's important when we think about health equity to recognize the ways that we draw on history and anthropology and other social sciences to better understand the distribution of power and resources. Whereas One Health is a slightly different approach and has a different history that kind of emerged from veterinary science and recognizing that many of the emerging diseases among humans are zoonotic infections. And so out from this movement, they crafted this notion of One Health, which, as Allison alluded to, stands at the intersection of human health, environmental health, and animal health, recognizing that all of these are critically integrated and are constantly interacting with each other and bear on each other, not just for human health, but human actions and behaviors also shape animal health and behaviors also shape environmental health, etc. So it's just constantly interacting Venn diagram, essentially. And with this understanding, the One Health movement makes the case that there must also be collaboration across sectors and disciplines that are, centered in each of these realms in order to promote improved health among all three. So with this collaboration, it's more possible to address a full spectrum of disease control and contribute to global health security, which I think is a really critical point in One Health. Its a main focus is to, try to not just better understand and coordinate or better understand zoonotic infections and how they emerge from these integrated realms, but also to work with one another to mitigate their emergence and their spread by using kind of multi-sectoral and international efforts at doing so. So I drew these specifically from the World Health Organization website, both to make a case for why an organization like the World Health Organization is incredibly important in our current day and age, but also to recognize the history of the World Health Organization, which dates back to cholera, in fact. So the cholera epidemics began in the early 19th century in the Bengal Delta region of South Asia. And in 1817, in the context of British colonization and imperialism, in which soldiers were, living in barracks, very tight quarters, very unsanitary conditions, while at the same time, the British East India Company was expanding trade and movement from this area of the world across many other parts of Asia and Africa and Europe. It was kind of in that context in which the first cholera pandemic sparked. Cholera has been a human disease for probably centuries, but up until 1817, it was really, these small epidemics were really just taking place in this small area of the world in Bengal. And in 1817, it rapidly spread and has since produced many different waves of cholera across the world that I'll get into shortly. But importantly to know, these epidemics during the 19th century led to the establishment of the very first international attempts at controlling sanitation. Cholera, as some of you might know, is a waterborne disease, and it was researchers in Britain at the time that discovered that it has this association with contaminated water sources. And so there emerged these efforts, the first, public health efforts many cite in terms of sanitation and water quality. And then it spread into this effort to expand those like coordinated attempts, ensuring that there was safe water and good sanitation. And nations at the time, mostly in Europe, and Turkey was also involved, recognized that, in order to protect all of our populations, we need to work together. And so thus emerged the first international sanitary conferences in 1851. And this was, like I said, the first moment at a global scale that nations were trying to address an infectious disease. Unfortunately, the cholera pandemics continued to grow. And so as these pandemics continued to spread, nations further escalated their attempts at coordination. While this started in Paris with the International Sanitary Conference, the United States was also working on our end to try to develop their own health security measures of protecting their populations. And we can talk about, the biopolitical reasons why nation states wanted to protect their populations from cholera. But that's probably a little adjacent to this talk today. But from these nascent attempts at coordination, these led into the years of World War I, World War II. The international sanitary conferences kind of fizzled apart as infrastructure improved, but they definitely set the stage for the coordination of the League of Nations, and then beyond the League of Nations, to establish the World Health Organization, which gathered for the first time in 1948 in Geneva, and still to this day recognizes its important roots in the early cholera epidemics and pandemics. So just to talk a bit more about cholera and Vibrio cholerae in particular, I do want to recognize that it's a little awkward to bring Vibrio cholerae into a discussion about One Health because it's really just a bacteria that infects humans. We are able to infect animals and insects on purpose in the lab, but for the most part, it's really just a human disease. And so if we think about that Venn diagram of humans and animals and environmental health, it definitely made me pause for a second and scratch my head like, oh, like where does cholera fit beyond the fact that it, inspired the World Health Organization, which is maybe like a prime example of a One Health coordinated attempt at global health security. How can I make sense of it as a One Health disease? And I think that cholera does a really good job, on the other hand, of reminding us of global health equity and its history related to colonialism and human transportation and movement and power and resources and their inequitable distribution. But I'll show just shortly how I kind of tied all of this together. And in order to do so, I really had to go back into the history of cholera, which I had mentioned before. And I think my cursor might work. Oh no, it doesn't work. But you can see kind of that orange dot is where the early cholera epidemic started and where the pandemic took off. This is a map of showing the spread of cholera from 1817 to 1831. And the tracks that you can see along the land are how cholera was thought to have spread over land. And then there are also some tracks marked in the oceans that show kind of how it caught on ships. And then these ships landed in different docks and spread cholera that way. And you can see it kind of spread both eastward and westward. That eventually crossed the Atlantic and made it to the Western Hemisphere. But one place it didn't arrive to was Haiti. And that was very much because the government of Haiti at the time, in the 19th century, was taking very intensive measures to protect its population, recognizing how vulnerable the Haitian population was at the time as a newly formed nation, independent from France as of 1804. So with all this in mind, cholera being a human infectious disease and spreading via human routes of transportation and power, how does it end up in Haiti? And the story is that Haiti had, as I mentioned before, not had an epidemic of cholera ever in its history, and that was confirmed by a group of researchers at Duke who did an intensive historical analysis of documentation and records related to diarrheal disease outbreaks in Haiti and found that it never had one up until 2010. In October of 2010, hospitals, medical centers, mostly starting on the coast in the coastal city of St. Mark, noticed that there was this influx of patients with profuse watery diarrhea. They had never seen anything like it before. And within 24 hours, that number had exploded, and there were patients, laying outside dying from cholera, which they took them about 24 hours, 48 hours to get the actual sample tested and confirm that it was Vibrio cholerae that had arrived in Haiti. And this particular strain was a strain of cholera that could kill people within 6 to 8 hours of initial symptoms. So I want you to hold in mind just how abrupt and terrifying this outbreak was for people in Haiti. So that first concentration of patients happened in St. Mark, and researchers, epidemiologists, journalists traced the cases back along this river, not knowing at the time whether or not it was cholera, and traced it back to this location upstream in Nibale. At the very, they were able to find both epidemiologically and kind of by surveying the situation there, that what had happened was that UN peacekeepers that had arrived from Nepal had allowed sewage to contaminate the river, and their sewage carried Vibrio cholerae, and that's how it was introduced into Haiti through the bodies of UN peacekeepers who were there on a mission to promote democracy and policing in the nation. And so after these initial cases in October, within a month, it spread throughout the entire nation and quickly became the most deadly cholera epidemic in the world in recent history, killing probably more than 10,000 people in a span of 8 years. Which I know compared to COVID-19 now sounds pretty small, but in a small nation like Haiti, where everything is very concentrated, and with that explosive spread and symptoms as I was describing, it was devastating. And people there recognized the injustice of the epidemic, and it led to many efforts to demand reparations and support and apologies from the United Nations, and that's still in process, unfortunately. Many victims of cholera have yet to be compensated for their suffering and losses. And that's how I ended up in Haiti. This is in the Artibonite region, kind of outside of St. Mark. I had been traveling to Haiti since 2008, as mentioned, and in 2015 was invited by a scholar at Harvard to help her out with some research in this particular region. She was curious about the intersections of food security and cholera, and she asked that I go to this rice farming region of the country because there had been so many cases there and so many deaths from cholera. So in 2015, I ended up there and made a lot of friends and started to learn about rice in the country. At this time, cholera was kind of in flux, but as a waterborne disease, you can imagine how easily it was for folks to get infected with cholera here when they're so dependent both on the river, which passed, through this region, but also spending day in and day out in water like this, and having limited access to clean water and sanitation. So with this, recognizing that cholera was very present in this region, and at the same time, how important and critical rice farming was to the people living there who were being impacted by this disease, I started to get really curious about, in this notion of food and agriculture and health, how does it impact on cholera, and whether protect or make people more vulnerable to its spread. And if we think about it through the lens of One Health, I think it really brings our focus to the role of agriculture in people's lives and humans' lives around the world. Maybe not necessarily something that a lot of us in this room might think about, but certainly around much of the world, people are farming constantly subsistence or for industry. And I think agriculture is a really important part of One Health because of the food, like foodborne illnesses, sure, and also the role of livestock in agriculture. And I think that's a clear tie that we can draw between the roles of meat and growth hormones and antibiotics and all these things that can potentially lead to impacts on health and microbial resistance. But I think that, if we think about growing crops, it's a bit different. And in that way, it draws our attention to the role of environmental impact of growing practices, whether that's through, how irrigation can change a landscape, how irrigation can change culture and behaviors, or this co-creation, I would say, of agriculture and human practices. I think is really helpful when we think about a disease like cholera, where folks are spending so much time in the water and around water. And then at the same time, people having access to being able to sell their rice and access food in general, I think is really important because it generates systems of inequity potentially. And when people are unable to sell the rice that they're growing, which is the case in Haiti, can also contribute to rising rates of poverty and food insecurity. What One Health does really well, I think, is, bring our attention to those intersections of things like agriculture and health and animal health as well. But I think what it could really use more of, which is what health equity and global health equity research does, is a recognition of the role of history and social behaviors that can often get missed when we're so focused on kind of a future-oriented notion of One Health and global health security. So that's how I came to spend a lot of time with rice growers and get really curious about rice in Haiti. This is actually a billboard picture that I would see in the northern city of Cap-Haïtien for years. I think I even took that picture maybe in 2011, or I started seeing it in 2011. And it translates to live well is live la joie, live healthily. And then USA rice is covered by that tree branch. But below it says, eat all your rice that comes from the United States to live healthy and, well, I guess, to live and live in health, essentially. So I was like, why are they promoting USA rice like this? That's so bizarre in a nation like Haiti where it's growing its own rice. This is another ad campaign by USA Rice that's more recent. This comes from 2022, which says, give me Bangu rice. And Bangu is the brand, but it also translates to good tasting rice. You can see it's emblazoned with the American flag and American rice and all these things. And so living with rice farmers who were getting sick with cholera and dying from cholera, and recognizing that they were suffering so much from poverty and asking them questions about that made me curious about, well, why is it, so if they're growing so much rice, or if they're trying to grow rice, why is it so hard for them to keep doing that, or to sell their rice in the first place? Because they would tell me that, they would really struggle with selling their rice compared to American rice. And as you can see in that chart, this has a lot to do with the fact that American rice is just flooding the nation and selling for half the cost of Haitian rice. So even though production of rice in Haiti has been pretty consistent over decades, there is definitely a change that happened in the 80s that allowed for the rapid escalation and explosion of rice imports in the nation. So I'll let Jackie take over from here and ask a few questions that get into more of the specifics. But that's kind of my argument for what rice has to do with it for now. Maybe it's fair, and I'll stand here.
All right, so thank you, V, for giving that great background so far on cholera and moving us into rice. So looking at this graph, there's a big change around 1983. So what actually happened then that made this big change and so much rice coming into the nation?
Yeah. So the history of rice in Haiti goes back to the early 20th century, in which there was this dedicated effort to expand water irrigation infrastructure in the country, especially during the U.S. occupation of Haiti from 1915 to 1934, sorry. That's when there was this attempt to help Haiti have infrastructure to grow its own rice. But at that time, Haitians didn't actually eat that much rice. It was not really a staple. Fast forward to the 1980s, where there was this kind of effort to produce rice in Haiti. The 1980s was a very tumultuous time in the nation. It was during a time of political change. There had been a dictatorship family in power in Haiti for some time, and this was kind of on their downfall. And the United States government, along with rice growing industries, one industrial power in the United States in particular called early industries, found this as an opportunity, found this political instability in Haiti as an opportunity to secure a market essentially for U.S. rice growers. And so in the 80s, there was this initiation of, I think it was under Reagan, who started the Caribbean Basin Initiative, which was it was early efforts at structural adjustment, policy change, trade promotion in the Caribbean in particular. And that was kind of the first inroad that rice companies, U.S. rice companies, had into the country. And then at the same time, they were also starting to bring in, what is it called, like black market rice, essentially. Like they would smuggle rice into the country while they were also promoting people to eat more and more rice. So there's also this escalation of consumption, and that escalated demand for rice and more smuggling and all these things. And then it wasn't until 1995, actually, where the trade adjustment, structural adjustment efforts that had started in the 1980s really escalated in 1995, where the US government essentially pressured the Haitian government to cut the import tariffs on rice, on US rice in particular, from 50%, which was also pretty low at the time for the Caribbean. They dropped it from 50% to 3%. And that really allowed for this explosion of cheap US rice into the country.
And as we know too, food in the US is already fairly cheap given the subsidies we have to our own industry. So that means it'd be a lot cheaper than the local rice. So how did the diet, what does, an average diet in Haiti look like now, maybe compared to what it looked like 40 years ago?
Yeah, hugely different. Prior to the 1980s, 1970s, the majority of Haitians, as far as I could learn and glean from research that has already been done by other food researchers in Haiti, a lot of the diet was staples like corn and other starches, potatoes, millet, locally grown starches. Rice at that time was very much kind of like a luxury food and seen as kind of an upper class food. But when it became cheap and cheaper, a lot of those behaviors rapidly changed. And so now rice currently constitutes about like a quarter of Haitians' dietary intake. I think even like USA Rice, and they like promote this. They're like, Haiti is the largest importer of US milled rice in the world. And we're doing so well with, all this rice that we're selling to them because we have, found that they eat so much rice, or we've made them eat so much rice. Anyway, I think the number that I saw on their website was that Haitians eat or consume about 85 kilograms of rice per year, which is it's very substantial. And this was backed up by non-USA rice data as well. So yeah, it's a very significant part. And even Haitians will often tell me that they haven't eaten, or it's a common saying that like you haven't eaten a meal unless if you've eaten rice. So almost every actual meal is like on a bed of rice.
And I'll have one last question for now that brings us into our kind of second topic of the day. So you originally went a lot to be thinking about cholera and how that's impacting rice farmers. And when you were there, what were the new things that you discovered and additional issues rice farmers were concerned about?
Yeah, I spent a lot of time both growing. Oh, I guess I should show this part. So I spent a lot of time in the rice fields being taught how to plant rice, and spent time with folks who, were sifting rice afterwards, cleaning it, and sitting down with groups of Haitian farmers. One group in particular, they're called group paysan, like peasant organizations, and sitting down with them and kind of going through this, they would go through this analysis, this historical analysis of the social determinants that have led to their present reality. And they would reflect on these histories of imperialism and occupation and capitalism and all these structural problems that really made their lives incredibly difficult and vulnerable. And I would just sit there and listen and learn from them. And that's kind of what inspired all of this work, really, was listening to Haitian farmers reflect on their realities and learning about this horrible injustice of the history of USA rice in the country. And at the same time, like while I would talk with them and listen to them and live in these communities, people were also telling me, how great Haitian rice is. And I can back that up. It tastes so good. Haitian rice tastes amazing. And they were telling me that anytime that they ate the American rice, though, it made them feel pretty ill, like indigestion, cramps, just didn't really feel well. And it definitely has a different flavor, very different flavor. So even though I know it's hard to, extrapolate from folks saying that they feel nauseous after eating a particular food that should otherwise be pretty safe to eat, it definitely got me thinking, got my gears turning about like, well, what if there could be a difference? What if there is a difference between these rice products? And wouldn't that be helpful to know for people who are eating so much rice? And wouldn't it be helpful to know for people who are buying so much rice? They could make better informed decisions about the rice that they're consuming, because there's not a robust, food study section of the Haitian government. And so this is actually a picture of me from 2016, I think. My brother took that of me, where this was actually me doing like my pilot study of collecting a handful of samples of rice, the rice that was grown in the country and rice that had been imported into the country, and bringing it back here to Michigan and convincing the head of the chemistry department or the chemistry lab to run these samples for me. And then we'll talk about, where it went from there. But all of it comes from spending time in this part of Haiti and with the rice growers there. All of this comes from them. So, yeah, now you'll talk about where it went from there. Cool.
So now V has given a really excellent introduction to, really the whole history of a nation almost, and lots of health issues there. But I'm very fortunate that I got to play a super small role in this by digging in on the question regarding, is the rice healthy or not? So in the context of everything V has talked about, we were able to conduct a research project, basically a pilot, saying, the farmers are worried that the imported rice is less healthy than what's grown there. Is there some kind of empirical evidence we can give to farmers that can help them prove that point or understand that? And so I'm normally a lab scientist, and I've done a lot of work with metals in the past. So before, 6 years ago, I didn't really honestly know almost anything about the history of Haiti. And I hadn't even worked with rice, but I worked with a lot of other kinds of media and toxic substances. So V came to my office and said, I just need a toxicologist that can get metals measured, and that's something I can do. So we started working together, and it's been one of the best projects I've ever worked on that's had the most impact. But basically, to just pare it down to, maybe 5 or 10 minutes explanation, we knew from a lot of other work throughout the world that one of the toxic things that can accumulate in rice is arsenic. Cadmium and mercury, which are toxic metals, can also end up in rice, but arsenic is the most common, especially in arsenic grown in certain parts of the US and certain other countries that are big rice producers. Some areas of the world have more arsenic in the soil. Sometimes it's because of natural causes, actually. It just naturally occurs there. And sometimes it's from historic pesticide exposure, since older versions of pesticides included a lot of arsenic, and that's kind of doesn't get out of the ground once it's there, once it's been used. So we knew that big regions where, especially like areas around Arkansas where rice is grown in the US, are known to have arsenic. And when we collect rice in the US and other scientists measure arsenic, they see it. And, it's often below what levels we consider safe for health, but it's there, and there's a substantial amount. And if you eat a lot of rice, that means you could be accumulating a lot of it in your body. And so because of this, and because of these small pilot in the chemistry lab, we decided to collect a lot more rice samples, imported and locally grown, in the Lower Artibonite Valley, and just, answer that question. Is arsenic higher or lower, in the imported samples compared to local? And that just lists, so, very simple, objective, and our hypothesis based on the farmers' complaints and also knowing what rice is like that's grown in the US, we thought it would be higher in the US grown rice, but, we weren't sure because no one had ever measured arsenic in rice grown in Haiti before. So basically, carefully designed the study to make sure we collected enough samples that it was well powered to detect a substantial difference. And then we had one field researcher who collected all the samples from the same region using the same protocol, very carefully. And everything was collected in 2020. And we had, a sampling design where he would collect from certain open air markets and a few, more like supermarkets, and get both imported and locally grown from the same place, make sure to get it from different farmers, from different imported sources. So we had a range. And then all of the samples were basically taken and collected, in the same ways, in the same amount. And we, even though it's more of the rice is from the US, we basically intentionally sample different brands and rice from other countries too, just to kind of get a bigger picture of any of the imported rice that could be there. So these samples were shipped to the US, where we just use a very standard process at well-certified lab to measure arsenic and cadmium. And then these methods had very low detection limits. So basically, even if there was a little bit there, we'd be able to see it. So what did we find? In a brief summary, we did find that the imported samples had almost exactly twice as high of arsenic as the locally grown. And then by and large, almost all the samples didn't really have cadmium at all. But the imported samples, we did find cadmium in those a bit more often than we did in the locally grown samples. And this is how you can kind of look at the arsenic graphically. We had a few donated samples too, but you could sort of loop them in with the imported because they come from similar sources and similar growing areas. But each black dot is a particular sample, so you can see there's not even really a lot of overlap between the groups. Like the local samples are almost always lower than basically every imported sample. And so what does it mean for health, though? These levels, I will say, are technically below what's, basically like worldwide organizations agree it would be okay to sell a food that has that much arsenic. That's fine. It's below a regulatory limit. But, who made the regulatory limit and what is it protecting against? And these are things in environmental health we're often changing and adapting. So we wanted to take into account the fact that a lot of citizens in Haiti are eating a lot of rice. And so we did basically a, kind of simulation. We hadn't done a dietary survey when we were there, but working with our partners, thinking about what realistic consumption levels are, and then calculating out, if an adult ate 1, 2, 3, or 4 cups a day, how much arsenic would they take in? If a small child ate certain amounts of rice a day, how much arsenic would they take in? And these, graphs are a little wild, but I can tell you the main take-home point is that when you take into account, basically like a person, so this is for adults, a range of body weights, so a range of sizes for an adult, and then a range of the amount of rice that they eat, which is each different colored line, and then look at, if they were eating, part A is basically local rice that has the average, part B is local rice on the higher side, and then below for imported. When you compare the values, kind of as you expect, they'd also be taking in a lot more arsenic depending on how much rice they eat. And when you compare these to some regulatory limits, people eating the imported rice would exceed an amount that's considered safe for health, especially if they're eating something like 3 or 4 cups a day. And then for little kids, who, could be the most vulnerable because of their small body size. Once again, little kids eating large amounts of actually even sometimes the local rice could be exceeding what we consider a safe value, but then that's twice that if it's the imported rice. So public health implications, some things to think about. When we tried to publish this, we had some issues because we measured total arsenic, but a lot of these regulations are made for a specific kind in organic, which was a lot more expensive to measure, and we weren't able to measure to speciate arsenic is what they say. But if we assume that, even 50% of what they're eating was inorganic, some of these individuals were still above what we consider a safe limit for health. And, so this is important information for people to know about, when there's a choice, in which there often isn't in Haiti because of, budgetary restrictions. But if there's a choice, and if local rice and other local produce can be promoted more, eating more of that would be better. So our partners in Haiti were really passionate about, sharing this information with as many people as they could. So they created these, flyers and translated in French and Haitian Creole and did tons of presentations to sometimes like hundreds of people at churches, at high schools, universities, and just, gave a short presentation, handed out these flyers. And basically some of these things that it says is that it just talks about higher arsenic in the imported and then gives people options. If you can, when you can, choose a local product over imported rice, even if you just substitute a few meals a day, a few meals like a week with, something else other than imported rice that could be helpful long-term. Because, at the beginning, kind of trying to tie these things together, and we talked about cholera, that's, fast-acting poison, disease. Arsenic is kind of the other ends of things. It's a slow burn. It's something that you don't know is there. And the health impacts of arsenic occur, which can be things like cancer, skin diseases, developmental diseases, occur after many, many years of low-level exposure. So there's time. I think, you can protect yourself by reducing the dose. The more you can reduce that dose over the lifespan, the better it will be for health. And so once again, this just kind of shows, these are pictures from our main partner there from his own farm, showing a lot of the other products that he grows and tries to teach people in his community how to grow, to say like, here's some things that, other foods that you can eat instead of rice or in addition to, then so we tried to, we're trying to also help him now promote some local agricultural programs that hope to increase production of, really things other than rice over, the next couple of years for them to be available and affordable to people in local communities. And then when we were giving presentations a lot, mostly virtually, to people in Haiti. And we also wanted to give a recommendation for if you already have tons of imported rice and that is all you can afford, because sometimes that's the case with the way things are right now. So we did find that there's actually a cooking method that can reduce about half of the level that, before you eat it, that gets rid of about half the arsenic. Unfortunately, it does require more water though, which can be a precious resource as well. But if water is available, this is a cooking method that can kind of get rid of some of the arsenic before you eat it. And then long term, of course, we hope that, we wanted to give this to local agronomists to, use it to know like, yes, there is something about our produce that is better than what's imported. And it's a piece of real evidence that can be used to support that and to help them promote their own products and things like that. But of course, very long term, we, policies for many reasons, not just because of the arsenic issue, need to be changed so that Haitian farmers and Haitian products are more widely available, more affordable, and more desirable in the market. Because, for 1,000 reasons, not just this arsenic issue, that's much better for the economy, for health, and for, things like that in the nation. So this is just, in summary, again, what we found. We did find a piece of evidence that shows there's more rice in this imported rice than local, and that because rice consumption is so high, this could be dangerous for health, though we didn't actually measure health outcomes in our study. And we're trying to use this information to long-term, impact policy, but short-term help people to make decisions when they can about what to eat and what to buy, and also help, give farmers something that helps them to knowing that, that they're right, their products in this case is definitely better. And so this work was supported by our Office of Global Public Health and the MQ program, and also by V's support when they were a student here. And we wouldn't be able to do this without our collaborators in Haiti, who actually don't want to be named because there's some political issues when you try to go against the rice industry as well, which we have faced a bit as well here. And yeah, so I just want to say thank you to them, even though I can't say their names at this time. But since we just have a little bit of time left, I think I'll bring V back up, and we want to give, the audience time to ask us questions. It's kind of a lot of topics all merging together, but hopefully it makes sense with One Health and definitely global health.
A great presentation. Is there much known about lead blood levels? And does that seem to at all vary in children or adults based on regionality or their sources of rice, if there is more of a local or more imported dominant?
Yeah, that's a great question, because that's one of the huge metals we worry about a lot too. I would say luckily it's not a metal that accumulates in rice, but it can be. I would expect to see that more in more like industrialized areas. So probably actually not where we were, but in some of the big cities, they might have more lead issues. But yeah, but we haven't looked at that. But I mean, that's a concern in many parts of the world. So,
And I think in Haiti, thinking about potential exposures to lead, probably more likely in, at least before the gasoline changes, could have been in gasoline, certainly in paint, but a lot of the water infrastructure, piped water infrastructure that, increases potential exposure here in the United States. In Haiti, a lot of it is like PVC piping, so not usually lead piping.
Thank you so much. This was super interesting. I'm a board student at the School of Public Policy, and I'm also a biology minor. And so this talk really kind of was a perfect intersection of kind of those kind of interests. But my question from a policy perspective, I understand that this was about Haiti, and I think that the kind of development on Haiti's economy and things like that were all super interesting and important. From U.S. policy specifically, how can we take these findings and perhaps apply them to domestically grown sources and things like that, whether that's like cleaning up like arsenic in these fields and kind of the South and things like that? Like, are there any procedures or environmental protocols that could be instituted to also just improve the quality of rice for rice grown in the US for consumers in the US and abroad?
That's a great question, and a core question underlying all of this, because neither Jackie or I are Haitian. We're not Haitian citizens. We didn't grow up there. Like I said, this research comes from the inspiration of working with Haitian farmers. But, there's not a lot that we can do for towards the Haitian government, because that's not our role. And we're trying to equip Haitians with information that they could potentially advocate their own government and nation for. As US citizens and folks with position of power in this country, I think that there are many policy questions that we can ask our government as well as the industries that exist in this country. I think there are two main ones that come to mind for me, one of which is what you're talking about, kind of what could be done to improve rice quality here in our nation through policy. And as Jackie said, a lot of the rice that is being imported into Haiti is coming from like the Mississippi River area. A lot of that rice is not actually sold in the United States. A lot of the rice that we find on our shelves, up until more recently, I've noticed, has been coming from California, and California has relatively very low levels of arsenic. So there are data out there of like consumer studies. There's this huge PDF from like 2013 or something that just did like a shelf consumer study of arsenic levels in rice products that you could find on grocery shelves at any like normal regular grocery store in the United States. And those levels of arsenic, at least in the long milled rice that we're studying, were relatively low and kind of on the levels that you would see in rice in Haiti. It's different for like processed rice products. There's like a whole spectrum and research into there. So yeah, I think that one thing that could be done could be to, on a policy level, think about how we could improve water quality that's being used in the rice fields in the middle part of the country and in the Mississippi River area. And then there are also policy questions that can be asked when it comes to the exportation of US rice, particularly to low and middle income countries, and particularly related to like humanitarian aid efforts where people really don't have any other options besides to consume the aid that's being given to them. Absolutely. And I wish that we had more time to do that, because it was like 12 years of my life essentially. And I was really lucky in a way. So my dad is an archaeologist, and he's been doing archaeological research in Haiti since the 70s. So I actually grew up learning Haitian history from when I was really little and developed a passion for it in high school. So I kind of entered Haiti for the first time in 2008 with, I guess, compared to what you would expect from like a public school education, a lot of like self-directed education on Haitian history. And I think that was very much appreciated by folks who I encountered. And then I studied Haitian Creole as a language in college. And so I also had some language background, which also really helps to develop relationships on like a human level with people and kind of mitigate that hierarchy, because certainly coming into Haiti as someone with a US passport, someone who's highly educated, etc., there's a huge difference in power there. And I think I tried in all my interactions to be aware of that and to try to interact with people in like a human way and hang out with them and do kind of like daily life. So I think that really helped. And then also just like showing that I was willing to, have some degree of vulnerability by working in the fields in the mornings with them, I think also really helped demonstrate a sense of camaraderie, and not just like as a visitor and as an extractor. But certainly I recognize that a lot of research in Haiti is very extractionary, and my career path and trajectory is definitely impacted and a product of that. So I think it's just important to recognize.
Great. I think we have one more comment or question. Scott, please.
Just want to make sure we don't miss your comments. So I have imagined that we have a room full of at least some public health students. And I wanted to build off of what you were just saying, B, where you sort of dropped this thing where it was like, well, I was hanging out with farmers and all of this came from them, right? So for those of us who can't go and spend 12 years and grow up in a family, and learn language, like with that level of depth, can you talk a little bit about, this comes from the fact that I know that you also have a PhD in anthropology, which also went under the radar in that talk. These were super powerful questions that, usually don't make their way into a chemistry lab at the University of Michigan, right? And they came from hanging out with farmers. So Can you talk a little bit about any advice that you might have about how you might incorporate some of that hanging out, even if it's not 12 years long, to find research questions?
Yeah, that's a great point, or many great points. And I think that one of the important things is not to expect that any of this happens quickly. That first time that I arrived in the rice farming area, I was actually stuck in St. Mark in the Partners in Housing because I didn't have my own vehicle and no one was willing to drive me there for whatever reason. And so I was stuck and felt really stalled for like 2 weeks. Nothing was going on until finally I hailed a friend who was on her way like up north through St. Mark and put all my stuff in her truck, and I just left. I made my way there and found housing and then just let things go slow for a little while. And I think that that's important. I think in everything is to remember that it's okay to go slow and develop just like a presence and, let people ask me questions, invite questions from folks. And then, yeah, it's really just like spending quality time, which can feel like a 24/7 job a lot of the time. I think ethnography and fieldwork is actually extremely demanding mentally and physically and socially. And I think spending that time and being dedicated to it eventually is like when you start to recognize what really matters, I think is what it comes down to. What questions are people asking of themselves and of their own realities, and what do they want to know, and how can I use my resources and connections and position of power to help folks answer those questions.
Well, it's clear that this topic and conversation could go on much longer, but just as we wrap up, I wanted to say thank you. My name is Joe Kolars, and I'm the director for the Center for Global Health Equity. Jackie V, this was terrific. I particularly appreciated your goal, which I think you easily met, is just the intersection of science with all of these other dimensions. All too often in a place like this, we just focus on the science, which is often the easy stuff, and our scientific inquiry. But bringing in the historical, the social, the cultural is something we need to do much more of. So I applaud you for that. It also reminds me of when I first met V as a student here. She, as you can imagine, was breaking new ground. In the medical school, we have an MD, PhD program, but all of the PhDs are in the life sciences. But V was going, no, I want to do anthropology. And she's paved the way for many other people to do non-life sciences PhDs that, again, bring things together. I think, in part because of her mentor, Paul Farmer at Harvard, luminaries like Scott Stonington and others that we have in our own community here. But I've just been in awe of your career trajectory since we met, and it's great to have you back. She is using her vacation time to get released as a resident to be here. So I want to applaud you again, V and Jackie. So thank you for coming today. I'll look forward to our next discussions. Thank you.